The good news is the Trump administration is taking more concrete action to get ready for what's likely to become an overwhelming situation at hospitals in the coming weeks.
We'll be invoking the Defense Production Act just in case we need it. In other words, I think you all know what it is, and it can do a lot of good things if we need it.
It appears we will need it. And if you don't know what those lot of good things are, the Defense Production Act lets the administration force the private sector to ramp up production on emergency medical items like masks, ventilators, respirators. Trump also said today that he's directing FEMA to help in the coronavirus response and that HUD is suspending evictions and foreclosures in their housing for the time being. So again, that's the good news. The bad news, the first words out of Trump's mouth today were these.
I would like to begin by announcing some important developments in our war against the Chinese virus.
Chinese virus. And when a reporter asked about the use of the phrase, suggesting correctly that it could be racist, Trump doubled down.
It's not racist at all, no, not at all. It comes from China. That's why. It comes from China. I want to be accurate.
To be clear, it is racist and makes Asian Americans vulnerable to attacks when the task at hand is to protect everyone from attacks of a different kind. Here in Massachusetts, just a couple hundred people have tested positive for coronavirus cases, but experts say the real infection rate is likely much higher, with some estimates putting it closer to 6,000 so far. And already hundreds of confirmed and suspected coronavirus patients have been checking into area hospitals, including Boston Medical Center, where State Representative Jon Santiago works as an ER physician. He now joins me via Skype. Doctor, thanks so much for being with me, as always. I appreciate it.
Thanks for having me, Jim.
I have heard that there are roughly 50 suspected cases at BMC. Have any of those been confirmed positive yet, Doctor?
Not as of yet. And so we've had about 50 come in. I've been admitted. More have come into the emergency department and been sent home, but there have been no confirmed cases yet.
Is your ER or ERs across the city ready for the surge, the spike that so many are anticipating?
I mean, it's an evolving process, right? I mean, the January alone, even before the coronavirus hit, was the busiest month in the history of the emergency department at BMC. Now, the strokes, the heart attacks, the car accidents don't stop. The setting is a very difficult one to work in, and no doubt that the coronavirus will add difficulty to that. But I trust in the hospital staff, the administrators, and leadership to get the job done.
Yeah, but it seems to me that some things may be beyond your control. Today we were talking to Senator Markey on the radio, who said, let me read this, nationwide there are stockpiled 12 million of the appropriate masks, the N95 respirator masks, and 3.5 billion might need 300 times as many. There was a hospital in Georgia reporting today they used up 5 months of protective gear in 6 days. Is that not a concern for you and your colleagues?
It's a tremendous concern. I mean, we're being very judicious with how we go around using masks, gowns, and the sort. We're looking into commercial providers. As you said, there's a strategic national stock supply. My guess it's not going to last very long. The fact that Trump is moving forward with the Defense Production Act is a step that we need to do. But look, if you don't have PPE, you can't test and treat patients with COVID-19. So it's a necessary thing to have.
I want to get to the tests in a second. I've also heard that some of your colleagues at Brigham and Women have actually gotten to the point where they have to reuse these masks, at least for one shift. I am not a doctor. I'm a pretty good patient, but I'm not much of a doctor. That sounds to me like a really dangerous proposition for a healthcare provider, isn't it?
Well, there are strategies to go around that. I mean, you can really limit the number of people who are going to be interacting with the patient suspicious of COVID-19. You know, I use an N95 mask. I try to use one a shift. But that's where we're at right now. And until we get further supplies from the federal government and the commercial providers, that's where we're at. What I can say is that the Secretary of State had asked the federal government for more masks and gowns and the sort, and they were able to comply with 10% of the demand. So the governor's advocating for more support and more services, as is the rest of us.
You know, let me stay on a couple of other needs. ICU beds. I'm told there are now some tents set up outside your place. Did they have anything to do with providing more bed space, or are they there for other purposes?
Well, the tents are there to increase capacity for testing.
I see.
The last thing we want to do is expose our healthcare workforce and other people in emergency medicine to COVID-19, right? So if we can test these folks outside the tent, the vast majority you could discharge them home for a self-quarantine for 14 days. But we don't want to bring those people to the emergency department and potentially expose them to healthcare workers.
So how are we on the ICU bed front? You concerned about that?
Well, the ICU bed front is an issue nationally, including the Commonwealth. And it's something that we're going to have to refigure and repurpose. Look at Carney Hospital in Dorchester. They've decided to turn their whole hospital into a care center for COVID-19. And that's what we're going to need more of. But increasing capacity, more hospital beds, ICUs, ventilators will definitely be a need that we have to look into emergently, because the surge will come, no doubt.
We've on the testing front, the first words we heard out of the president a week or so ago was there's a test for everybody who wants it and it's perfect. We know that story has changed many times on the national level. But I am told that in the city, not only are the number of tests still limited, but the swabs that are necessary to do the tests are now unavailable. Is that true?
Well, I mean, the swabs are in demand across the whole country. I think they're made in Japan. I myself, in my personal experience of swabbing patients, if I need to swab a patient, the test is available to me. But right now, as the CDC has broadened the guidelines, we're testing more people. It's a great thing. We're increasing capacity at the state lab. And I've also brought a couple of commercial providers on to increase capacity overall. I mean, I think we're moving in the right direction.
Doctor, a lot of this changes because this is this novel, as they say, coronavirus. One of the things that changed was how long the virus might remain on a surface, particularly a hard surface. The other thing that Dr. Deborah Birx raised today, which was rather shocking at the coronavirus task force thing, and she's the coordinator of the White House's force, is that they were getting some troubling news out of hospitals in Italy and France that young people were coming down seriously ill. Is that different calculation causing great concern in your world?
Well, that's a very concerning dynamics of the situation. I mean, for what we've been told is that the vast majority of people, 4 to 5, will not need to be hospitalized. 20% will be hospitalized, 5 of which will require ICU care. But if we're talking about younger people getting sick, and I've seen those reports coming out of France and Italy, it is quite a concerning development.
Can we move from Boston Medical Center to your other job at the State House? I'll call you representative for this one. I saw the release today that the Speaker of the House was saying the first confirmed case of coronavirus in an employee at the State House had been diagnosed. What does that mean for the 200 men and women, reps and senators, for the governor, for everybody else who's working up in that building?
Well, quite frankly, it would mean the same thing for you and I. I mean, we know community transmission is going on around the whole Commonwealth, 7 counties, and people are entering office buildings, state buildings, hospitals. I mean, and I would just say what the U.S. Surgeon General had: you should act like you've been exposed to the virus. You should be home, stay self-quarantining, practicing good social distancing.
Jon Santiago, I wish you great luck in both your jobs as the days go ahead. Thank you so much for your time. I appreciate it.